If you are over 60 and you have been dealing with joint pain, there is a very good chance you have been telling yourself the same thing millions of other seniors tell themselves every day. It is just arthritis. It is just getting older. There is nothing I can do about it. But doctors are now warning that certain types of joint pain after 60 are not just normal wear and tear. They are warning signals from your body that something more serious may be going on, and ignoring them could lead to permanent damage, disability, or even life-threatening complications. I know that might sound dramatic, but by the end of this video, you will understand exactly why doctors take these specific joint pain signs so seriously, and you will know exactly what to do if you recognize any of them in yourself. So please, give me your full attention for the next few minutes, because this information is simply too important to miss. Let me describe an experience that is incredibly common among seniors. You wake up in the morning and your knees are stiff. Your fingers ache. Your hips feel tight and sore. It takes you a good 20 or 30 minutes of moving around before you start to loosen up and feel somewhat normal. Maybe by midday you are feeling okay, but by evening the pain is back. You take some over-the-counter pain reliever, maybe apply some cream, and go to bed, hoping tomorrow will be better. This cycle repeats day after day, week after week, month after month. Over time, you just accept it as your new normal. You modify your activities to avoid pain. You stop doing things you used to enjoy. You tell yourself that this is just what it means to get old. But what if some of those symptoms are actually your body trying to tell you something urgent? What if the type of pain, the location, the pattern, or the accompanying symptoms are clues that something beyond ordinary arthritis is happening? I am Dr. Charles Anderson, and I have worked with hundreds of seniors who thought their joint pain was just aging, only to discover that it was actually caused by a treatable condition that, had it been caught earlier, could have been managed much more effectively. Today, I am going to walk you through 7 specific joint pain signs the doctors say should never be dismissed as just arthritis after the age of 60. For each sign, I will explain what it could mean, why it is concerning, and what you should do about it. I will also share practical strategies for managing joint pain and protecting your joints for years to come. So let us get started. The first joint pain sign that doctors want you to take seriously is a sudden, severe pain in a single joint that comes on rapidly, often overnight. If you go to bed feeling fine and wake up with one joint, often the big toe, the knee, or the ankle, that is red, hot, swollen, and excruciatingly painful, this is not typical osteoarthritis. This pattern is classic for gout, which is a form of inflammatory arthritis caused by the buildup of uric acid crystals in the joint. Gout is far more common in seniors than most people realize, particularly in men over 60 and in postmenopausal women. It can be triggered by certain foods, medications, dehydration, and kidney function changes that are common in older adults. While gout might sound like a minor inconvenience, untreated gout can lead to chronic joint damage, the formation of large crystal deposits called tophi, and even kidney stones and kidney damage. Gout is also associated with an increased risk of heart disease. The good news is that gout is highly treatable. Medications can relieve the acute pain and prevent future attacks, and lifestyle modifications can reduce uric acid levels. But it needs to be properly diagnosed and managed, not just endured. The second sign is joint pain that is significantly worse in the morning and lasts for more than 30 minutes after you start moving. Now, many people with osteoarthritis experience morning stiffness, but it typically resolves within 15 to 20 minutes of moving around. If your morning stiffness and pain last for more than 30 minutes, or even for hours, This pattern is more suggestive of an inflammatory type of arthritis, such as rheumatoid arthritis. Rheumatoid arthritis is an autoimmune condition in which your immune system mistakenly attacks the lining of your joints, causing inflammation, pain, swelling, and eventually joint destruction. While it is often thought of as a condition that starts in younger adults, rheumatoid arthritis can absolutely develop for the first time after 60. In fact, late-onset rheumatoid arthritis has some distinct characteristics that differ from the younger-onset form. It tends to affect larger joints, like the shoulders and knees, more prominently, and it can come on quite suddenly. Early diagnosis and treatment with disease-modifying medications can dramatically slow the progression and prevent the irreversible joint damage that untreated rheumatoid arthritis causes. So if your morning stiffness and pain are lasting more than 30 minutes, please see your doctor and ask about inflammatory arthritis. And the third sign might surprise you. It is joint pain that is accompanied by a fever, especially if the fever is new and you cannot explain it by another illness. When joint pain comes with a fever, doctors immediately think about two possible causes that require urgent attention. The first is septic arthritis, which is a bacterial infection inside the joint. Septic arthritis is a medical emergency that can destroy a joint within days if not treated with antibiotics and sometimes surgical drainage. It is more common in seniors because the immune system weakens with age, and people with existing joint problems, diabetes, or conditions that suppress the immune system are at higher risk. The second possibility is a systemic inflammatory condition like adult-onset Still's disease or vasculitis, which can cause joint pain along with fevers and other symptoms. Both of these conditions require prompt medical evaluation. If you have a swollen, painful joint along with a fever, do not wait to see if it gets better on its own. See a doctor that same day or go to an emergency room. The consequences of delaying treatment for septic arthritis can be devastating. The fourth sign is joint pain that seems to move from one joint to another, or that affects the same joints on both sides of your body symmetrically. Osteoarthritis tends to affect joints that have been subjected to the most wear and tear, and it often affects joints asymmetrically, meaning one knee might be worse than the other. But when joint pain is symmetrical, affecting both wrists, both knees, or both hands in a mirrored pattern, it is often a sign of an autoimmune or inflammatory condition. The migratory pattern, where pain moves from one joint to another over days or weeks, can also suggest specific conditions like reactive arthritis, rheumatic fever, or certain connective tissue disorders. These conditions are treatable, but they require a correct diagnosis to manage effectively. If you notice that your joint pain is symmetrical or seems to jump around from joint to joint, mention this pattern specifically to your doctor, as it is an important diagnostic clue. The fifth sign is joint swelling that does not go away. It is normal for a joint to swell briefly after an injury or a particularly active day. But when a joint remains swollen for weeks without improvement, or when the swelling is disproportionate to the amount of activity you have done, something more than simple osteoarthritis may be at work. Persistent joint swelling can be caused by chronic inflammation from an autoimmune condition, by an infection, by crystal deposition diseases like gout or pseudogout, or in rare cases, by a tumor in or near the joint. Fluid accumulation in the knee, sometimes called water on the knee, is particularly common in seniors and can be caused by many different conditions. If you have persistent swelling in any joint, your doctor can perform a procedure called joint aspiration, where they use a needle to withdraw some of the fluid from the joint. Analyzing this fluid can provide crucial information about what is causing the swelling and guide appropriate treatment. The sixth sign is joint pain, accompanied by significant weakness or difficulty using the affected limb. While pain itself can make you reluctant to use a joint, true weakness, where the muscles around the joint are not responding properly, is a different and more concerning symptom. This can indicate nerve compression, tendon damage, or muscle inflammation. One condition that is commonly overlooked in seniors is polymyalgia rheumatica, which causes severe pain and stiffness in the shoulders, neck, upper arms, hips, and thighs. It almost exclusively affects people over 50, with the average age of onset being around 70. The pain and stiffness can be so severe that people have difficulty raising their arms above their heads, getting out of a chair, or climbing stairs. Polymyalgia rheumatica is caused by inflammation and is very effectively treated with low-dose corticosteroids, often with dramatic improvement within days. But it needs to be properly diagnosed because it can sometimes be associated with a more serious condition called giant cell arteritis, which affects the blood vessels in the head and can lead to vision loss if not treated promptly. If you are experiencing severe pain and stiffness in your shoulders and hips, along with fatigue and a general feeling of being unwell, please see your doctor and ask about polymyalgia rheumatica. The seventh sign, and this is one that too many people overlook, is joint pain that wakes you up at night. Osteoarthritis pain typically worsens with activity and improves with rest. So if your joint pain is bad enough to wake you from sleep, it suggests that something other than, or in addition to, simple osteoarthritis is going on. Nighttime joint pain can be a sign of inflammatory arthritis, infection, crystal-induced arthritis, like gout, or in some cases, bone-related problems, such as avascular necrosis, where the bone in a joint begins to deteriorate due to loss of blood supply. Nighttime pain is also sometimes associated with bone tumors, though this is rare. The point is that pain that is severe enough to disrupt your sleep deserves medical attention. Do not simply take more pain reliever and hope it goes away. See your doctor and get a proper evaluation. Now that we have covered the 7 warning signs, let me talk about some practical steps you can take to protect your joints and manage joint pain more effectively. The first and most important step is to stay active. I know this seems counterintuitive when your joints hurt, but research consistently shows that regular, gentle exercise is one of the best things you can do for arthritic joints. Exercise strengthens the muscles around your joints, which takes pressure off the joint itself. It improves flexibility and range of motion. It promotes the production of synovial fluid, which lubricates the joint. And it helps control weight, which reduces the load on weight-bearing joints like the knees and hips. Low-impact activities like walking, swimming, cycling, and Tai Chi are excellent choices for seniors with joint pain. Even stretching and gentle range of motion exercises done at home can make a significant difference. The second step is to maintain a healthy weight. Every pound of body weight translates to roughly 4 pounds of pressure on your knees with each step. So losing even 10 pounds can reduce the force on your knees by 40 pounds per step, which over the course of a day adds up to an enormous reduction in joint stress. If you are overweight, gradual weight loss through a combination of dietary changes and increased activity can provide meaningful pain relief and slow the progression of arthritis. The third step is to explore anti-inflammatory dietary approaches. The Mediterranean diet, which I have mentioned in previous videos, is rich in anti-inflammatory foods like fatty fish, olive oil, nuts, fruits, and vegetables. Studies have shown that people who follow a Mediterranean-style diet have lower levels of inflammation and report less joint pain compared to those who eat a typical Western diet. Certain foods are particularly beneficial for joint health, including turmeric, which contains the anti-inflammatory compound curcumin, ginger, which has both anti-inflammatory and pain-relieving properties, and omega-3 fatty acids from fish like salmon, mackerel, and sardines. The fourth step is to use heat and cold therapy strategically. Heat, such as a warm bath, heating pad, or warm compress, can help loosen stiff joints and relax tight muscles. It is often most helpful in the morning when stiffness is at its worst. Cold therapy, such as an ice pack wrapped in a towel, can help reduce swelling and numb pain, and is often most helpful after activity when joints are inflamed. Alternating between heat and cold can sometimes provide the best relief. The fifth step is to talk to your doctor about appropriate pain management. While over-the-counter medications like acetaminophen and ibuprofen can be helpful, they are not without risks, especially for seniors. Ibuprofen and other NSAIDs can cause stomach ulcers, kidney problems, and cardiovascular issues with long-term use. Acetaminophen can be hard on the liver, especially if you drink alcohol. Your doctor can help you find the safest and most effective pain management approach for your specific situation, which might include prescription medications, physical therapy, joint injections, topical creams, or other modalities. Let me also mention that joint replacement surgery has become incredibly safe and effective for seniors who have severe arthritis that does not respond to conservative treatments. If you have been told that you might need a knee or hip replacement, do not let fear hold you back. Modern joint replacement surgeries have excellent outcomes, with most patients experiencing dramatic improvements in pain and function. The recovery period has also shortened significantly thanks to advances in surgical techniques and rehabilitation protocols. Many seniors who have joint replacement surgery say they wish they had done it years earlier. I want to close by encouraging you to listen to your body. Your joints are remarkable structures that have served you faithfully for decades, but they are also vulnerable to a wide range of conditions that go far beyond simple wear and tear. Before I wrap up, I want to address a few more topics that are directly relevant to joint health in seniors that many people never consider. The first is the role of hydration in joint health. Your joints are cushioned by cartilage, which is made up largely of water. When you are adequately hydrated, the cartilage remains plump and resilient, providing good shock absorption and smooth gliding surfaces. When you are chronically dehydrated, which is surprisingly common in seniors who may not feel thirsty even when their body needs water, the cartilage can become less effective at cushioning the joint. Over time, this can accelerate cartilage breakdown and worsen arthritis symptoms. Aim to drink water throughout the day, not just when you feel thirsty. Many experts suggest that seniors should drink at least 6 to 8 glasses of water per day, though the exact amount depends on your body size, activity level, medications, and other health conditions. The second topic is the importance of vitamin D for joint health. Vitamin D plays a critical role in calcium absorption and bone health, but it also has anti-inflammatory properties that can benefit your joints. Studies have found that people with low vitamin D levels are more likely to have arthritis and more likely to experience progression of existing arthritis. Many seniors are deficient in vitamin D, particularly those who spend most of their time indoors or who live in regions with limited sunlight. A simple blood test can determine your vitamin D level, and if it is low, supplementation under your doctor's guidance can help. Getting moderate sun exposure, eating vitamin D-rich foods like fatty fish and fortified dairy products, and taking supplements as needed can all help maintain adequate vitamin D levels. The third topic I want to address is the connection between joint health and mental health. Living with chronic pain is exhausting, frustrating, and isolating. Many seniors with joint pain develop depression, anxiety, or both, which can create a vicious cycle. Depression can reduce your motivation to exercise and take care of yourself, which makes joint pain worse. Pain makes depression worse, which further reduces motivation. If you are dealing with chronic joint pain and you find that it is affecting your mood, your sleep, your appetite, or your enjoyment of life, please talk to your doctor about it. There are effective treatments for depression and anxiety, including therapy and medication, and addressing your mental health can actually help reduce your perception of pain and improve your ability to manage your joint condition. You do not have to suffer in silence, and seeking help for the emotional impact of chronic pain is just as important as treating the physical symptoms. I also want to mention the role of physical therapy in managing joint pain. Many seniors do not realize that physical therapy is not just for recovery after surgery or injury. It is also an incredibly effective treatment for chronic joint pain and arthritis. A skilled physical therapist can design an exercise program tailored specifically to your joints, your pain patterns, and your goals. They can teach you techniques for protecting your joints during daily activities, recommend assistive devices that reduce joint stress, and use treatments like manual therapy, ultrasound, and electrical stimulation to reduce pain and improve function. If you have not tried physical therapy for your joint pain, ask your doctor for a referral. Many patients find that it provides significant relief and helps them return to activities they had given up. One more thing that I think is worth mentioning is the importance of proper footwear for joint health, especially for your knees, hips, and back. The shoes you wear every day directly affect the forces transmitted through your lower body joints with every step. Worn-out shoes, shoes with poor support, or shoes that do not fit properly can alter your gait and increase stress on your joints. Investing in well-fitting, supportive shoes with good cushioning can make a noticeable difference in joint comfort, particularly if you are active. Some people also benefit from orthotic inserts that correct alignment issues and distribute pressure more evenly. If you have persistent knee, hip, or back pain, consider having your footwear evaluated by a podiatrist or physical therapist. Finally, I want to speak to the topic of supplements for joint health because I know many of you are either taking or considering glucosamine, chondroitin, MSM, or other joint supplements.
The research on these products is mixed.
Some studies show modest benefits for certain people, while others show no significant effect compared to placebo. What I can tell you is that these supplements are generally safe for most people when taken as directed, but they are not a substitute for proper medical care, exercise, and other evidence-based treatments. If you are interested in trying a joint supplement, talk to your doctor first to make sure it does not interact with any of your medications, and give it an adequate trial of at least 2 to 3 months before deciding whether it is helping. And remember, if you are experiencing any of the 7 warning signs we discussed today, no supplement is going to be sufficient. You need a proper medical evaluation. The 7 warning signs we discussed today: sudden severe single joint pain, prolonged morning stiffness, joint pain with fever, migratory or symmetrical pain, persistent swelling, pain with weakness, and nighttime pain are all signals that deserve medical attention. Do not dismiss them as just getting old. Get them checked out because the right diagnosis can lead to treatment that dramatically improves your quality of life. If this video has been helpful, please subscribe to this channel and share it with anyone who deals with joint pain. The more people who know these warning signs, the more people will get the help they need. I am Dr. Charles Anderson, and I will see you in the next video. Take care of those joints and take care of yourself.